So you want to be a nurse. You'll need to know these 4 steps to help you write the best nursing resume possible. I'm Chloe from Resume Genius, and I'll show you how to do just that. Your finished resume will showcase that you're a compassionate healthcare professional with the skills necessary to provide superior patient care, regardless of your experience level. Don't discharge yourself before the video ends, because I'll be giving you access to 8 free nursing resume samples that'll help you structure your own. Let's begin. Step 1. Choose your template and write a good introduction. For your nursing resume, choose a subtle design without flashy graphics and fancy fonts. You want your skills and qualifications to be the center of attention, not solely the design. The first section is your resume introduction, which is located just below your header, so it's one of the first things a hiring manager sees when they pick up your resume. A good resume introduction does 3 things. 1. Highlights your top skills. 2. Showcases your great accomplishments as a nurse. And 3. Mentions any relevant education, certifications, or licenses you have. By including this key information close to the top of your resume, you ensure that hiring managers immediately understand that you meet the basic qualifications of the role. Step 2. Highlight your work experience. Let's move on to the main part of your resume, the professional experience section. This is where you'll list all of your previous job titles. Start at the top with the most recent to least recent and add 3 to 6 bullet points for each job title. Go into detail about what you achieved in each position in these bullet points. Pro tip: make sure to quantify your accomplishments. For example, if you're a certified nursing assistant, you could write something like this. Doesn't that sound more impressive and credible than if those 2 numbers weren't included? This bullet point works because it not only shows that the candidate contributed to creating a safer environment for the patients, but it also shows exactly how successful their efforts were. Are you a nursing student and concerned that you don't have enough work experience to fill a 1-page resume? Or maybe you're in the process of changing careers and haven't worked in healthcare before. Don't worry, you can include internships, volunteer work, or other relevant experiences that have helped you develop skills that a nurse needs. Step 3. Include your education and certifications. Write down the name of your school followed by the degree and graduation date. You can also include your GPA if you're a new grad nurse, but only do so if your GPA is 3.5 or above. All nurses need at least a CPR certification. If you don't have more than 1 or 2 certifications, you can just list them in your education or skills section. But if you have more than that, you should add a separate section on your resume to keep it looking organized. Regardless of where on your nursing resume you list them, you should include the name of the certification, the name of the awarding institution, and the year it was awarded. Here's another pro tip. For licenses, replace the year it was awarded with the date it was renewed and add your license number. A lot of licenses need to be renewed every 2 or 3 years, and hiring managers need to know that you're legally allowed to practice. Step 4. Choose your hard and soft skills. As a nurse, you know that compassion and excellent people skills are crucial to getting along well with both patients and coworkers, and you should definitely include soft skills like these on your resume. However, I recommend incorporating those into bullet points in your work experience section and highlighting hard skills here instead. Here are some examples of hard skills you can include in your nurse resume skills section: wound care, medication administration, diagnostic testing, pediatric examinations, medical software, IV injections, ECG, and catheterization. Adding these to your resume will give recruiters an easy overview of your most relevant skills, so they can quickly determine if you'll be a good fit for the role. Here's a pro tip. If you're not sure what skills to include, check the job ad again. It'll likely tell you everything you need to know about which abilities the position requires. If the job description is vague, take a look at job ads for similar roles but at different clinics or hospitals. Those act as cheat sheets that will help you figure out which skills are most relevant for the job. As promised, here's a link to the free samples I mentioned earlier. Each one has its own set of writing tips in case you're looking for more expert advice. Before I let you go, I'd like to refer you to this video on how to write a cover letter. A well-written cover letter gives employers better insight into who you are as a person and why you'll be a great addition to the team. So it can really help nurse your application to the next level. Best of luck from the Resume Genius team, and we'll see you next time.